Aloha, I'm Dr. Taketa-Wong. Thank you for joining me. What I'd like you to take away from my talk is that every core symptom of autism can potentially be traced back to metabolic disorders. These disorders are often part of what I call the underlying cause matrix for symptoms we typically associate with autism. Things like difficulty focusing and paying attention, trouble with communication, tantrums, meltdowns, and aggressive behavior. When we treat the medical issues stemming from metabolic problems, part of the underlying cause matrix, autism symptoms improve, sometimes dramatically. The metabolic system includes our thyroid, adrenal glands, liver functions, and more. With metabolic disorders, we see disruption of the normal biochemical processes that allow us to grow, repair damage, and respond to our environment, processes that sustain life and the normal everyday functions of our body. Now, let's begin with methylation, a biochemical process that is the foundation for many other processes in the body. Methylation includes the production and breakdown of neurotransmitters, which are brain chemicals. Those can affect attention, focus, language, mood, and behavior. Methylation is also the foundation for liver detox, which is the process of breaking down toxins and waste products and getting them out of the body. In addition, methylation is a foundation for maintaining hormone balance. A majority of children with autism have problems with methylation. That means they will have problems with brain chemicals, which is one of the reasons that their language, mood, and behavior can be different. It can also be why these children have difficulty getting toxins out of their body. One result of having methylation issues is that children with autism can be more vulnerable to damage if they're exposed to lead, mercury, or BPA. Research has also shown that when methylation problems are corrected in children with autism, then their behavior, language, and mood improves, sometimes dramatically. I want to mention that for now we are still welcoming new patients, and to make sure that our practice is the right choice, there is a no-charge phone consultation with me in advance of scheduling your initial appointment. This is so I can talk with you personally about your health concerns. The phone and other contact information is on our Facebook page. Also, please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Now, next I want to look at oxidative stress. Oxidative stress is a process where our body makes free radicals, which it uses to kill bacteria, viruses, and other things that can make us sick. Our body also makes antioxidants, which counteract the effects of the free radicals. We're supposed to make free radicals when they are needed, and then at a certain point, like when the infection is over, our body is supposed to stop making them. Then there are the antioxidants, whose job is to clear out any excess free radicals. Oxidative stress is when there is an imbalance between the free radicals and the antioxidants. When there is too much oxidative stress, it means that there are too many free radicals and not enough antioxidants. This can result in excessive inflammation that occurs in our body. Research has shown that 68.9% of children with autism have oxidative stress levels that are too high. Oxidative stress, especially in the brain, has been linked to problems with brain function, which can then cause difficulty with language, behavior, mood, and so on. We have medical protocols that correct the imbalances, which often leads to major improvement in the symptoms. I want to note that we see a similar phenomenon happening in people with Alzheimer's. Of course, there's a great difference in age, but we see some of the same difficulties with language and mood, plus memory, of course. Next, we'll look at thyroid issues because, based on lab tests, as much as 51% of children with autism have abnormal thyroid function. By contrast, the incidence of abnormal function in neurotypical children is less than 1%. Some symptoms that can be present in children with thyroid problems include constipation, speech and developmental delays, sleep difficulties, hyperactivity, or feeling tired all the time. There can also be problems with eating, focus, concentration, bedwetting, and a tendency to become anxious or depressed. Research has found that if a woman is pregnant and she has low levels of thyroid hormone, she is 4 times more likely to have a child with autism than if her thyroid is normal during pregnancy. Again, when a child with autism is treated and their thyroid is functioning normally, there is often great improvement in their symptoms. What about the adrenal glands and autism? The adrenal glands make a hormone called cortisol in response to stress. A significant number of children with autism have cortisol levels that are either abnormally high or abnormally low. If it's high, they tend to be overweight, be in a fight or flight state all the time, are irritable, have anxiety, difficulty concentrating, and have headaches. Many children with autism are unable to say what's troubling them. So, out of understandable frustration with being in pain, they may bang their head on the wall or the floor because their headache won't go away, or engage in aggressive behavior towards others, or have self-injurious behavior where they bite or scratch themselves. I've also seen children with too little cortisol. If that's the case, they may have poor appetite, they might be tired all the time, and I've seen also children where even if they're tired, it manifests with hyperactivity. So the child may look very hyperactive, but underneath it could actually be that they're overtired, and that contributes to behavioral problems. They may also have muscle weakness, and they could have difficulty with focusing and paying attention. Lastly, we have mitochondrial dysfunction, which is quite common in children with autism. In fact, studies have shown that up to 80% of these children have this problem. Symptoms include developmental delay, seizures, tiredness, and digestive issues, especially constipation. Also, they may develop skills and then lose them later on, like running, jumping, speech, or really any skill that they developed. This condition, as with other metabolic disorders, responds to medical treatment. When I treat children with autism, I spend a lot of time with the parents to find out as much as I can about the child's symptoms. Based on that, I will order lab tests for the child to screen for any of the problems that are most likely based on their symptoms. That could mean blood tests, urine tests, or other tests. Treatment varies because it is different for each of the symptoms. In general, treatment will include specific foods to eat or not to eat based on the results of the lab tests. To strengthen the child's body and support certain processes and functions, again, based on their symptoms and lab results, I'll also prescribe medical quality nutrients, vitamins, minerals, homeopathics, and herbs. Pharmaceuticals can also be in the protocol if called for. What I'd like you to take away from my talk today is that autism symptoms are tightly connected to a variety of medical problems. When those medical problems are resolved, we see behavior improve, many times dramatically. I trust our discussion about autism and metabolic disorders has been valuable for you. With our no-charge consultation, you're welcome to talk with me personally about your child's condition or any other health concerns you may have so that you too can be empowered with your health. All the contact information is on our Facebook page. If you purchase supplements, please also visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are competitive with Amazon. You can trust the products, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.